Hello, my name is Dr. Carolyn Salter, and I'm a urologist specializing in male sexual and reproductive medicine. Today, we're going to talk about Peyronie's disease. So, Peyronie's disease is a condition when men form scar tissue or a plaque in the covering of the penis underneath the skin. This often results in a curvature, which is what most men think of when they think of Peyronie's disease, but men can also get what we refer to as volume loss deformities. So this could be an indentation in the penis, an hourglass deformity, or even penile narrowing. Peyronie's disease can be associated with pain, usually in the erect state, but some men get pain of the flaccid penis as well. Peyronie's disease has an active phase and then a stable or a chronic phase. So active phase Peyronie's disease is defined as the presence of penile pain and a progressive deformity. So in a large percentage of men with Peyronie's disease, they can actually get progression where the curvature or the volume loss slowly worsens over time. And why this is important is that you don't want to do any invasive treatments during the active phase disease because this disease could still be progressing and you might still end up with a curvature even after you complete your treatment. So it's important to wait until patients are in a stable phase disease for any invasive treatments. That being said, men with active Peyronie's could still benefit from certain treatments. For example, I recommend nonsteroidal anti-inflammatories like ibuprofen in men who have pain from active Peyronie's disease. These men could also benefit from traction therapy, which could potentially help to worsen further changes in curvature of the penis. And also, there's some newer evidence that low-intensity shockwave therapy is helpful for pain during active phase of Peyronie's disease, but there's no data yet to suggest it actually helps with the curvature. Once men are stable for a period of 3 to 6 months, then we state that they're in a stable or chronic phase of Peyronie's disease. And this is when you can begin more invasive treatments for these men. The first step is really a formal curvature assessment where your provider will inject the penis with a medication to cause an erection. And then we do a series of measurements of the penis. And we typically will do a penile ultrasound as well to evaluate your blood flow. Depending on the severity of your curvature and your erectile function, then we can give you a better understanding of what options could be best for you personally. But in general, all men with Peyronie's disease, even in the chronic phase, could potentially benefit from traction therapy. So that's an option for you. There's also something called intralesional injections, where we actually inject a medication into the Peyronie's disease plaque. These are done in a series of injections over time. The FDA-approved drug for this is called Xiaflex, or collagenase clostridium histolyticum. There's also a medication called verapamil that can be injected directly into the plaque. And these will take multiple sessions. They're usually done in conjunction with penile traction to help you get maximum benefit from the injections. And you can also do something called modeling, which your provider can show you how to do, but you gently bend the penis against a curvature to try to help stretch and break apart that plaque in conjunction with the injections. If you're not a candidate for injections or you don't want to go that route, then there are surgical options. Men can undergo application, which is when we put permanent stitches under the skin and the penis to essentially shorten the long side of the penis to result in a straighter erection. We can also do plaque incision and grafting, where we actually surgically cut out that scar tissue or plaque, put a graft over it, and then the penis is straighter or that volume loss deformity has been corrected. And then lastly, in men with really severe Peyronie's disease or men who have Peyronie's disease with erectile dysfunction, then a penile implant could be a really nice option for you. But the first step is just to have chronic phase or stable disease and to have a curvature assessment with your physician, because depending on the severity of your Peyronie's disease, every option might not be a good option for you. So it's important to talk to your urologist. Thank you.